Hello friends, welcome back to our YouTube channel Aminia Dental Tutorials. Today we are going to learn about the topic properties of dental amalgam. We are going to see properties such as dimensional change, strength, creep, retention of amalgam, tarnish and corrosion, micro leakage one by one. Dimensional change. According to ADA specification number 1, the dimensional change of amalgam should be in range of 15 to 20 microns per centimeter at 37 degrees Celsius between 5 minutes and 24 hours after beginning of trituration. Theory of dimensional change: contraction, expansion. Contraction: when the alloy as well as the mercury, when these both mix it together, alloy as well as mercury, when this gets mixed together, it results in contraction initially because the particles dissolve and the gamma 1 it grows. When alloy as well as mercury, when these both get mixed together, particles dissolves and gamma 1 grows. The final volume of the gamma 1 is less than the initial volume of silver and mercury that go into making of gamma 1. The final volume of gamma 1 is less than the initial volume of silver and mercury that go into making of gamma 1. Therefore, contraction will continue as long as the gamma 1 grows. As long as the gamma 1 grows, the contraction continues. When the alloy as well as the mercury, when it gets mixed together, the contraction begins because the particles dissolves gamma 1 as the particles dissolves as the gamma 1 it grows. The final volume of gamma 1 is less than the initial volume of silver and mercury. Therefore, as long as the gamma 1 grows, contraction continues as the gamma 1 grows. Now let's see about the expansion. As the gamma 1 crystals, as they grow, they impinge against one another. Impinge against one another. As the gamma 1 crystals they grow, they impinge against one another and produce outward pressure tending to oppose the contraction. To oppose this contraction, they tend to produce an outward pressure. Gamma 1 particles as they grow, they impinge against one another, and to oppose the contractions, they produce an outward pressure. If there is sufficient mercury present, an expansion will occur when crystals impinge on each other. When these crystals, when they impinge on each other, when sufficient amount of mercury is present, if sufficient amount of mercury is present, then expansion will occur. Expansion takes place. If this mercury is not present in adequate amount, if mercury not present, then contraction will occur. Contraction takes place. Sufficient amount of mercury present, expansion. If not adequate amount of mercury is not present, then contraction will occur. Factors affecting contraction. Factors factors favoring contraction. Let us see the factors which are favoring the contraction. Small particle size, small particle size, and low mercury alloy ratio, low mercury alloy ratio, high condensation, high condensation, and more trituration. Remember this, small particles, it favors contraction, and low mercury alloy ratio, high condensation, and more trituration. See, during high condensation, mercury gets squeezed out. Mercury squeezes out. During high condensation, mercury squeezes out. If mercury squeezes out, there will be decrease in residual mercury. Residual mercury decreased. Then, as we know, if mercury decreases, it leads to contraction. Contraction occurs. So factors favoring the contraction are small particles, low mercury alloy ratio, high condensation, and more trituration. There is an important point. Modern amalgamators, modern amalgams show net contraction. Modern amalgams, they show net contraction, whereas older amalgams, they always show expansion. Always expansion. Modern ones contraction, whereas the older ones always expansion. They always showed expansion. And the reason behind it is, these older amalgams, they contained large alloy particles. Large alloy particles. See, we know if small particles are present, it favors contraction. As the particles, large alloy particles are present for old amalgamators, obviously expansion will occur. Next one more is, before, in olden days, before, only hand trituration was used. Only hand trituration was used. Therefore, expansion. Modern amalgams, they are mixed with high speed amalgamator. They are mixed with high speed amalgamators. Modern amalgams use high speed amalgamators. More trituration takes place. Therefore, favors contraction. Whereas for older amalgamators, hand trituration was used. Once again, modern amalgamators, they used high speed amalgamators. Modern amalgams used high speed amalgamators. Therefore, more trituration occurs. Therefore, favors contraction. Modern amalgams favors contraction. Whereas older amalgams, hand trituration was used. Hand trituration was used. Therefore, more trituration doesn't occur. Therefore, it favors expansion. Modern amalgams show net contraction, whereas older amalgams always showed expansion. Let us learn about strength. Amalgam restorations have a good compressive strength. They have good compressive strength. Amalgam cannot withstand high tensile or bending stresses, whereas tensile strength not so good. Not so good. Amalgam restorations cannot withstand the high tensile or bending stresses and they can fracture easily. Fracture easily in improperly designed restorations. Improperly designed restorations. They fracture easily. They have good compressive strength, whereas tensile strength is not so good, and the tensile strength is 48 to 70 megapascals. One more property creep we are going to discuss. Creep is defined as a time dependent plastic deformation. Time dependent plastic deformation. Creep of dental amalgam is slow progressive permanent deformation of set amalgam which occurs under constant stress or intermittent stress. Once again, creep of dental amalgam is slow progressive permanent deformation. Slow progressive permanent deformation which occurs under constant stress or intermittent stress. If it occurs under constant stress, it is known as static creep. It is known as static creep. If it occurs under intermittent stress, it is known as dynamic creep. Creep is the time-dependent plastic deformation. It is a the creep of dental amalgam is a slow progressive permanent deformation which occurs under constant stress known as static creep and which occurs under intermittent stress is known as dynamic creep. The value of creep is high creep value for low copper amalgam and the value of creep is low creep values for high copper amalgams. Now let's discuss about retention of amalgam. Retention of amalgam. Another property. Amalgam does not adhere to the tooth structure. Retention of amalgam filling is obtained through mechanical logging. Retention of amalgam is obtained through mechanical logging. This is achieved by proper cavity design. This is achieved by proper cavity design. Retention of amalgam filling is obtained through mechanical logging. This is achieved by proper cavity design. Additional retention, if needed, can be obtained by placing pins within the cavity. By placing of pins, additional retention we can obtain. Once again, as amalgam does not adhere to tooth structure, retention of amalgam is obtained through mechanical logging. This is achieved by proper cavity design. Additional retention, if needed, then it is achieved by placing of pins within the cavity. Now let's discuss about tarnish and corrosion. Tarnish and corrosion. Amalgam restorations often tarnish and corrode in the mouth. As tarnish and corrosion occurs, black silver sulfide can form on the surface of an amalgam restoration in some patients. In some patients, black silver sulfide can form on the surface of amalgam restorations. Both high and low copper amalgam show corrosion. Both high and low copper amalgam show corrosion. Amalgam restorations often tarnish and corrode in the mouth. Black silver sulfide can form on the surface of an amalgam restoration in some patients. Both high and low copper amalgam show corrosion. Corrosion of amalgam can be reduced. Corrosion can be reduced. Corrosion can be reduced by smoothing and polishing the restoration. By smoothing and polishing. By smoothing and polishing the restoration. Next, by correct mercury alloy ratio and proper manipulation. Proper manipulation. Correct mercury alloy ratio. Corrosion can be reduced by the following factors: smoothing and polishing of restoration, proper manipulation, and correct mercury alloy ratio. And the last property we are going to discuss is about micro leakage. Dental amalgam has a tendency to minimize the marginal leakage. The small amount of leakage under amalgam restorations is unique. Leakage decreases as the restoration ages in the mouth due to corrosion products. Restoration as it ages in the mouth due to corrosion products. Due to formation of corrosion products that are formed in the tooth and the restoration surface. Formed in tooth and restoration interface. These corrosion products over a period of time seal the interface and thereby prevent the leakage. Seal the interface and thereby prevent leakage. Thus, we know amalgam is a self-sealing restoration. Self-sealing restoration. See, micro leakage. It is actually a gap that forms between amalgam filling and tooth structure. Gap between amalgam filling and the tooth structure. Dental amalgam has a tendency to minimize marginal leakage. The small amount of leakage under amalgam restorations is unique. The leakage decreases as the restoration ages in the mouth due to formation of these corrosion products that are formed in the tooth restoration interface. Formed in tooth and restoration interface. These corrosion products over a period of time they seal the interface and thereby prevent this leakage. Therefore, amalgam is known as a self-sealing restoration. Now let us revise what we have studied. Properties of dental amalgam. We have seen all these: dimensional change, strength, creep, retention of amalgam, tarnish and corrosion, and micro leakage. Dimension according to ADA specification number 1, the value of dimensional change should be in between 15 to 20 micrometer at 37 degrees Celsius per centimeter, 5 minutes and 24 hours, within 5 minutes and 24 hours after the beginning of trituration. When it comes to contraction, see when alloy as well as mercury, when these both together they are mixed, the contraction begins. Contraction begins as the particles dissolve and gamma 1 grows. The final volume of gamma 1 is less than the initial volume of silver and mercury. Therefore, as long as the gamma 1 grows, the contraction it continues. Now, when it comes to expansion, when the gamma 1 particles when impinge against one another, outward pressure will be produced. If sufficient amount of mercury is present, expansion takes place. If sufficient amount of mercury is not present, then contraction occurs. Factors favoring contraction are small particles, low mercurial ratio, high condensation, and more trituration. See, we got to know that modern amalgams used to undergo net contraction, whereas older amalgams always undergo expansion. The reason behind it is modern amalgams used to use high speed amalgamators. Therefore more trituration occurs, therefore it favors contraction, whereas old amalgamators during olden days before then hand instruments was used, therefore more trituration doesn't occur, therefore it leads to expansion. Now let's discuss about the strength. Dental amalgam has good compressive strength, whereas tensile strength is not so good. It fractures easily if improperly designed. In improperly designed restorations, tensile strength value is 48 to 70 megapascals. Creep. Creep is the time dependent plastic deformation. For dental amalgam, creep is slow progressive permanent deformation which occurs under constant stress, known as static creep, and if it occurs under intermittent stress, it is known as dynamic creep. High creep value for low copper alloys have high creep value, whereas for high copper alloys the creep value is low. Next, retention of amalgam and the property. Here it is mechanical locking occurs. It is achieved by proper cavity design. It placed with to get additional retention. Pins are placed within the cavity to attain additional retention of amalgam. Additional retention of amalgam is achieved by placing of pins within the cavity. Next, we studied about tarnish and corrosion. Tarnish and corrosion. Black sulfide can form on the surface of amalgam restorations. Both high as well as low copper alloys show corrosion. Corrosion can be reduced by smoothing and polishing of restorations, by proper manipulation, and by correct material alloy ratio. Micro leakage and the property. Actually, it is a gap that is formed between amalgam filling and the tooth structure. Decreasing leakage restoration as it ages in the mouth due to formation of corrosion products formed in tooth and the restorations interface. These corrosion products they seal the interface and thereby they prevent leakage. Therefore, amalgam is known as a self-sealing restoration. Thank you. Subscribe to our channel.